This is Neural Newscast for Monday, June 29th, 2026.
Today's essential headlines include security crises abroad and medical breakthroughs at home.
Pakistan launched lethal airstrikes along the Afghanistan border late Sunday night. Officials say they targeted militant hideouts. Information Minister al-Khawarij linked the operation to a weekend attack in Karachi that killed 3 security personnel.
The Taliban government reports the strikes hit 3 eastern provinces, killing 36 civilians and wounding over 164. They have condemned the action as aggression and maintain their territory does not house militant groups.
Islamabad identified the targets as safe havens for the Pakistani Taliban and Jamaat-ul-Ahrar. This surge in violence breaks a ceasefire established in March and follows months of cross-border friction.
The provinces involved are already struggling with border closures that have displaced thousands of people. Islamabad insists regional stability requires the Taliban to stop supporting organizations near the frontier.
Mediators from China and Saudi Arabia have seen little progress. The border remains closed. Pakistani officials maintain these operations are necessary for national security, as they also navigate mediation between Washington and Tehran.
Afghan authorities cite a history of civilian casualties from these operations, including a strike on a drug treatment center in March. Non-combatants remain at significant risk in these disputed zones.
Army Chief Field Marshal Asim Munir has stated that peace depends on the Taliban ending support for militancy. Both sides are currently on high alert, with no signs of a new ceasefire.
Humanitarian organizations are now assessing the damage in eastern Afghanistan. The international community is waiting for a formal response from the United Nations regarding the reports of civilian deaths.
In medical news, research in the Annals of Internal Medicine suggests the Shingles vaccine significantly reduces dementia risk. A study of 500,000 nursing facility residents found the Shingrix vaccine was associated with a nearly 6% lower risk.
The vaccine may protect brain health by preventing neural inflammation. Doctors explain that shingles can trigger inflammation in the nervous system that accelerates cognitive decline.
Similar studies in Wales, Australia, and Canada show reduced risks ranging from roughly 2 to 3.5%. Some researchers estimate that 1 in 17 dementia cases could potentially be prevented by vaccination.
Access is a persistent issue. Less than half of eligible Americans have received the shot. In this specific study, only 2% of nursing facility patients were vaccinated despite their vulnerability.
The data suggests this vaccine might be more effective at reducing neuroinflammation than the flu or Tdap shots. It may help the body clear proteins directly linked to Alzheimer's.
Shingles is also tied to higher risks of heart disease and stroke. Authors note that protecting cerebral arteries from viral damage is a critical secondary benefit.
Turning to travel, more United States airports are swapping federal TSA officers for private security firms. San Francisco and Kansas City International are currently the largest hubs using private contractors.
The change is often invisible to passengers because private contractors wear similar uniforms and follow TSA procedures. In Kansas City, the workforce is managed by Virginia-based VMD Corporation.
The federal government is now promoting a Gold Plus program to encourage this private model. The goal is to improve efficiency while keeping strict federal oversight and auditing.
While most commercial airports are still federally staffed, more are opting for private firms nearly 25 years after the TSA's creation. Authorities say private firms offer better staffing flexibility during peak seasons.
On social media, President Trump claimed no one left his recent speech at the Great American State Fair in Washington. However, video from the 28-minute address showed dozens of people departing about halfway through.
The event on the National Mall commemorated the country's 250th anniversary. Observers noted that while many stayed, high heat and military flyovers likely contributed to the early exits.
The president has a history of exaggerating crowd retention. Previous reports from campaign stops in Michigan and North Carolina also documented audience members leaving before he finished.
Interviews with those leaving past events often cite traffic or personal obligations. Despite claims of matchless magnetism, these patterns appear typical for long political speeches.
Fitness icon and former Olympian Les Mills has died at the age of 91. He founded an Auckland gym in 1968 that grew into a global brand, famous for programs like Body Pump.
Mills was a decorated athlete, competing in 4 Olympic Games and winning 5 Commonwealth medals. He also served 3 terms as the mayor of Auckland, focusing on public health and support for the disadvantaged.
His son, Philip, said his father's spirit lives on in workouts worldwide. The brand is now a leader in choreographed exercise, training instructors in hundreds of countries.
He was appointed a companion of the New Zealand Order of Merit for his service to sport and government. His legacy continues to influence the global fitness community.
Here is what else we are following. We will have updates on the Afghan border situation as damage assessments continue.
We are also tracking new clinical data on the link between vaccines and long-term neuroprotection in seniors.
And the TSA is expected to provide an update on its private security outreach to regional airports later today.
Tomorrow, we will look at shifts in international agricultural trade.
From Neural Newscast, I'm Noah Feldman.
And I'm Hannah Whitmore.
Thank you for joining us.
Neural Newscast is AI-assisted, human-reviewed. View our AI transparency policy at neuralnewscast.com.